adapting to the physiological needs of the periodontal ligament. Coming to the structures present in the connective tissues. The connective tissue, which occupies a lot of connective tissues, which includes the fibroblasts, cementoblast, and osteoblasts. Common cells in the periodontal ligament, they appear as a ovoid or elongated cells which are oriented along the principal fibers, and they can exhibit pseudopodia-like processes. And the ground substance of the periodontal ligament, which contains a large proportion of the ground substance that fills the spaces between the fibers and the cells. And the cells, which consist of two components, that the glycosaminoglycans, such as the hyaluronic acid and the proteoglycans and the glycoproteins, such as the fibronectin, laminin, P3, which has also higher water content. And the surface of the proteoglycans, which participate in several biological functions, which including the cell adhesion, cell to cell and cell matrix interactions, binding to various factors as photoreceptors and the cell repair. And this, for example, the fibromodeling has been identified in the bovine periodontal ligament. And the most comprehensive study of these proteoglycans in the periodontal ligament was performed with the use of this fibroblast culture of this human periodontal ligament. And the structures which are present on the connective tissue, which include the blood vessels, the lymphatics, nerves, and seminiferals. And coming to the blood vessels which are present in the periodontal ligament, which includes that mainly the blood vessels are derived from the inferior and superior alveolar arteries to the maxilla and the mandible, respectively from the three sources, which includes the apical vessels, the vessels which are penetrating from the angular bone, and the anastomosing vessels from the gingiva. And the blood vessels supply is more seen in the posterior region than the anterior. And the gingival third blood supply is greater than that of the apical third and greater than that of the middle third in the posterior teeth. And the mesial surface of the mandibular molars are greater than that of the distal surfaces, according to Bilnach in 1966. Coming to the nerve supply, the nerve fibers which supplying the periodontal ligament, which contains of two types, which includes the sensory and autonomic fibers, which follow the same forces as the blood vessels. The periodontal ligament is abundantly supplied with the sensory nerve fibers, which can transmit the tactile pressure and pain sensation by the trigeminal pathways, and the nerve bundles, which passes from the periodontal ligament from the periapical region to the channels from the alveolar bone. Coming to the venous drainage, these accompany the arterial counterparts, and the venules receive the blood from the abundant capillary network, and they are seen more frequent in the apical and the intramedicular region. The lymphatic drainage of the periodontal ligament, which consists from the periodontal tissues to the adjacent angular bone, and they are drained into the lymph nodes of the head and neck region. Coming to the cementicles, which are the calcified masses which are adherent or maybe detached from the root surfaces and can be more seen in the older individuals. These are considered that they are developed from the calcified epithelial cells and around the small spicules of cementum or alveolar bone that are traumatically displaced into the periodontal ligament, or maybe from the calcified sharpy corridors or from calcified thrombosed vessels within the periodontal ligament. Coming to the functions of periodontal ligament, according to the 14th edition of Ferenczi, there are various functions that can be done by the periodontal ligament, which includes the supportive, sensory, nutritive, formative, and homeostatic function. Coming to the physical functions, the periodontal ligament as the provision of the soft tissue piece to protect the vessels and the nerves from the injury by the mechanical forces, and the transmission of occlusal forces to the nerve, and the attachment of teeth to the bone, and the maintenance of the gingival tissues in their proper relationship to the teeth, and the resistance to the impact of occlusal forces. That means that helps in the shock absorption. Coming to the resistance to the impact of occlusal forces, there are two theories which are pertaining to the mechanism of tooth support, which has been considered, which includes the tensional theory and the viscoelastic theory. The tensional theory of the tooth support states that the principal fibers are the main factor in supporting the tooth and transmitting the forces to the bone. When a force is applied to the crown, these fibers first unfold and strengthen, and they transmit the forces to the bone, and thereby imposing an elastic deformation of the bony surface. Finally, when the alveolar bone has reached its limit, the load is transmitted to the base center. The many investigators have found this theory is insufficient to explain the available experimental evidence. And coming to the viscoelastic theory, It states that the displacement of the tooth is largely controlled by the fluid units, with the fibers having only a secondary role. That when a forces are transmitted to the tooth, the extracellular fluid which passes from the periodontal ligament into the narrow spaces of the bone to the foramina and the cribriform plate. And these perforations of the cribriform plate link the periodontal ligament with the cancellous portion of the alveolar bone, and they are more abundant in the cervical third than in the middle of after the completion of the tissue fluids, the fiber bond is absorbed and slack and tightened, and this leads to a blood vessel stenosis. And arterial back pressure causes the ballooning of the vessels, and passage of the blood ultrafiltrates into the tissues, thereby replenishing the tissue fluids. Coming to the transmission of occlusal forces to the bone, mainly the arrangement of principal fibers is considered as the suspension bridge or armor. So when an axial forces is applied to a tooth, there is a tendency towards the displacement of root into the annulus of first. The fibers which alter their vary or intense the pattern and assume their full length and they sustain the major part of the axial forces. So when there is a horizontal or tipping forces is applied, the two phases of tooth movement has been observed. That includes the first one, the forces which where horizontal forces is observed, that the first is within the confines of periodontal ligament and the second produces a displacement of facial and lingual bone plates. The tooth rotates above an axis that may change as the force is increased. That the apical portion of the root, which moves in a direction that is opposite to the coronal portion. In areas of tension, the principal fibers will be taut rather than wavy. And in areas of pressure, the fibers are compressed and the tooth is displaced and a corresponding distortion of the bone exists in the direction of the root movement. In single rooted teeth, the axis of rotation, which is mainly located between the apical third and the middle third of the root, and the root apex and the coronal half of the clinical root have been suggested as the other locations of the axis of rotation. Okay, which is narrowed, as we already said, in the region of the axis of rotation. In multi-rooted teeth, the axis of rotation, which is located in bond between the roots, and in combination with this physiological migration of the tooth, the periodontal ligament is thinner on the nasal root surface than the distal surfaces. Coming to the formative and remodeling function, the periodontal ligament and the alveolar bone cells are exposed to physical forces in response to the mastication, parafunction, speech, or orthodontic tooth movement. And the cells of the periodontal ligament participate in formation and the absorption of the cemented and the alveolar bone. And although applied loads may induce vascular or inflammatory reactive changes in the periodontal ligament cells, the current evidence suggests that these cells have the mechanism to respond to these mechanical forces via the various activation of mechanosensory signaling systems, which includes the amylase cyclase, activated ion channels, and via the changes in the cytoskeletal organization. And the periodontal ligaments are constantly undergoing remodeling, and all the cells and the fibers which are broken down and they are replaced by the new ones. And the mitotic activity can be observed in the fibroblasts and the endothelial cells. The fibroblasts, which form the collagen fibers, and the residual mesenchymal cells, which develop into osteoblasts and the cementoblast. Therefore, the rate of formation and differentiation of the osteoblasts, cementoblast, and fibroblasts affect the rate of the formation of collagen, cement, and bone. And there is a rapid turnover of sulfated glycosaminoglycans glycans in the cells, and the amorphous brown substance of the periodontal ligament is also occurs. And it should be noted that most of the studies have been performed which are on the products, and the information about the primers and the kidneys are sparse. Coming to the nervous supply. The bundles which are divided into single myelinated fibers which lose their myelin sheath and end in one of the four types of neural termination, and which includes the free endings that which have a tree-like configuration of the that carry the pain, and the roughly-like mechanoreceptors which are located primarily in the apical area, and they coiled missionary corpuscles, which is also mechanoreceptors, which are found mainly in the midroot region, and spindle-like pressure and vibration index, which are surrounded by the fibrous capsule and which are located mainly in the apex. So the periodontal ligament is mainly supplied by the sensory nerve fibers, which are capable of transmitting the tactile pressure and pressure pain sensations via the trigeminal pathways. The nerve bundles, which passes mainly, as we told already, the periodontal ligament from the periapical region and through the channels from the alveolar bone, and then it follows the same course of the periodontal ligaments. And coming to the nutritive function, the periodontal ligament supplies the nutrients to the cilium, bone, and gingiva by the way of blood vessels, and it also provides lymphatic drainage, as we already discussed. And coming to the aging of the periodontal ligament, the aging occurs in all the tissues of the body, including all the ligaments, and the number of the cells and their activity which increase, and the scalloping occurs in the cementum and the annular bone. And some of the fibers are attacked at the peaks of those scallops only and not in depressions, and this effectively affected the subgrowth of the filter. And if in general and dental health is good, periodontium may remain health even in the advanced stages. There will be reduced formation of this collagen, and the structural integrity of the collagen can be reduced in the aging purposes, and the width of the periodontal ligament will be decreased during the aging period. And with aging, due to the restricted and soft diet stimulation, the periodontal ligament is reduced. Clinical considerations of the periodontal ligament data. In aging, which results in more number of elastic fibers and decreasing in the vascularity, mitotic activity, hyperplasia, and in the increasing number of collagen fibers and the mucopolysaccharides. If the gingivitis is not cured and the supporting structures become involved, and the disease is termed as the periodontitis, and there are fewer focal cells and more motile rows and the spirochetes in the diseased site than in the healthy site, and the bacteria consist of gram-positive facultative rods and the cortei in the healthy site. While in the diseased site, gram-negative rows and anaerobes are more in number. And trauma to the ligament due to the mechanical separation can produce pathogenic changes such as the fracture or resorption of the cementum and the tears of the fiber bundles, necrosis, etc. And in cases of orthodontic treatments, there are also the periodontal ligament reducing limits can be seen. Higher mechanical stresses, the length width of the periodontal ligament. In cases of apical the abscess or any infection, the width of the periodontal ligament can be widening, can be seen, and in acute trauma cases, there will be widening of the periodontal ligament can be seen, and there is a discontinuity in the laminar dura. It can be seen in the radiograph. So, periodontal ligament plays an important role in the diagnosis of the by viewing the radiographs and the confirmation of this periodontal diseases. So, it's all about the periodontal ligament. Thanks.